I'm a woman living with AIDS, and I'm here to show support for people like me around the world. I know this is a preventable disease, and I know that this disease is really plaguing women right now, and it's very important that we end this.
I don't understand why people are so complacent about the disease. Why is this not scaring us?
People have decided this epidemic is over. People have decided it's manageable. People have decided enough is enough.
I think we still in our community don't realize the gravity of the impact of HIV and AIDS.
When you're talking to individuals, just your common average person on the street about HIV and AIDS, it's as though the notion is not going to happen because it's not in my house and it's not in my backyard. And as much as we continue to educate our community that HIV doesn't discriminate, there's still that notion that it's not going to happen to me. As women of color, in some respects, we might not see ourselves at risk, be it if we're married or we're in a long-term relationship. So the notion is that, well, as long as I know my husband or my partner, I'm not at risk for HIV.
I had trusted my husband. You know, we were together like 4 years, and then I got married to him. And in the midst of it, I caught pneumonia. He says, well, honey, you need to know I'm positive. I have the virus. And you're positive. That's why you're sick. And I'm like, oh, yeah, I can't hardly breathe. It still didn't dawn on me that what he was saying was that I was infected. That he put me at, that I put myself at risk, you understand, by getting to the relationship night, not questioning, his behavior, not questioning my behavior. I didn't realize that it would endanger my health.
Some of the factors that contribute to Black women constantly putting ourselves in risky situations is that, number one, we're worried about our immediate concerns. How do we feed ourselves? How do we clothe ourselves? How do we clothe our children? How we feed our children and keep a roof over our head? And so everything else becomes secondary, and you really don't worry about preventive health care. You really don't worry about contracting AIDS and any of those things because you're worried about the primary needs.
There are so many psychosocial issues that I think the epidemic thrives on. So when you look at issues of poverty, racism, sexism, when you look at issues of marginalization, power dynamic, gender roles, I think unless we are simultaneously looking at the psychosocial along with the clear medical public health issue of HIV/AIDS, we're not really going to get the end goal that we want.
Back in the days, it was drugs, sex, and rock and roll. Being that my husband was snorting and couples were snorting, I got into snorting heroin. I really did get, addicted and get into the whole drug scene until I met my second partner. When I met my significant other, he was a heroin user, and being a female and felt that I needed to validate myself, being with a man, I started doing heroin again. I became addicted. I only got high with my men. I did not enjoy getting high by myself, but that was a tool to be with them. And through our addiction, I'm assuming more so the addiction than, sex. I found out that we both found out we did have the virus.
Most women who are becoming affected is through heterosexual contact, and that be it from their long-term partner or their husband. When we talk to women in particular about the use of condoms, you would get feedback as, but why should I use a condom with my husband?
With women, I find that if it's a choice between with a heterosexual relationship, keeping a man and or using that condom, if you're an insecure female or financially it's better to have 2 paychecks, or you are afraid that there is going to be domestic violence, that condom becomes secondary.
Women need to not be afraid to talk about sex to their partners. We need to talk about sex. We need to talk about relationships. And we need to be honest with ourselves and be honest in a relationship.
At the end of the day, the beginning of the day, HIV/AIDS is about relationships, good or bad. Do we empower men and women to have honest conversations about sex and sexuality? It's just not done. I think in order to have healthy relationships, man and a woman, man and a man, woman and a woman, you got to start with a healthy sense of self.
In order for us to really talk about how to protect our community, we need to bring both males and females to that conversation.
African Americans and Hispanics are disproportionately affected in this country by HIV. Over 65% of all new infections are African American and Latino, and specifically women. And we only make up 12% of the entire population of this country. That's catastrophic.
I think around the world what we are seeing is that AIDS is a disease that mainly affects the black and poor women who are marginalized. And we need to raise up and look at issues of black women as human rights issues that deserve the world's attention.
If ever there was a time to genuinely demonstrate our belief in the future of our young people, that time is now.
We send this challenge out to all, that the black diaspora, the black Christian church, will in fact mobilize its people, mobilize this country, so we can see an ending to AIDS in our lifetime.
Hi, my name is Maria Davis, and I'm living with AIDS myself. And I've been diagnosed since 1994, and I thought it was important that I be here to see what your plans are. Now, all of the political executives and all that good talk is very good. But the thing is, my people are not getting the information. We got to get out there on the streets. It's important that we save each other, and it's important that we save our youth, because they are dying, they're getting infected. Let's get to work, let's get busy. Take your suits off, come in here with a raggedy shirt. I don't care about all them suits. Let's do some work. God bless you.
It's a global epidemic among people of color, and it's a disease that's going to devastate our communities, and it is in our backyards. So we have to face it one way or another.
I think the challenge of merging all of the different pieces around HIV/AIDS, it's to actually broaden the responsibility for HIV/AIDS prevention, treatment, and care.
It's about us getting down and dirty and doing the work, knocking on doors, if that's what we have to do in every building, and asking people, have you been tested? Do you have loved ones that have been infected? What can we do to help you?
That's how bold we have to get about this disease, because the disease is fighting us back. It's mutating, it's gaining more people on its side, and we have to treat HIV/AIDS awareness, just like I think Jehovah's Witnesses teach. You know, they go door to door. We need to get that bold, because if not, 50, 100 years from now, there'll be somebody passing by in a museum and they'll say, that's a black person. They existed 100 years ago, but they were wiped out by HIV/AIDS.